My name is Peter Kingori Ndegwa. I live on Kiambu Road, and I have been living with ulcerative colitis and a liver transplant, which was done a few years ago. COVID-19 has made things a bit more difficult because I'm not able to go to hospital to get my blood tests done as regularly as I would like, because before the pandemic I used to go either once every 2 weeks or once a month. But now I'm a bit afraid to go to hospital. I take immunosuppressants, so my immunity is low. So I'm more prone to get any infection, and in this case, coronavirus. The medicines I'm taking, I have to take them for the rest of my life. And some of them are not available here. So we've had to get them from India, because in Kenya, they're very expensive to get here. And sometimes some drugs are not even available. People living with non-communicable diseases require support from the government in the form of cheaper access to medicines, cheaper access to health services, doctors, or visiting clinics. So it would be good if the government would increase the support that NHIF offers. That would help with the drugs and the hospital visits. These conditions are not something that someone asks for or you even want to have, because when your health is affected, it affects the rest of your life.
I have lived with epilepsy for the past 17 years now. Since the pandemic started, I can say my life has changed drastically. I used to get my medication at a fair price, but now kind of found the prices had been hiked. And now when it comes to going to see my doctor, I can't do that anymore. The government should just step in. We need counseling. I'd say counseling is the most important thing right now, because we need to be talked to. Yeah, we need to understand that it's going to be better.
I've been living with this health condition for now it's 6 years. Here I am amputated. What can I do? Nikafikiria even suicide, so depression ilikuwa imeingia, but family was there for me. Kutoka I stayed like for 3 months indoors without going outside. And then one day my mom told me that Moses, this is a leg imekatwa. Si makucha, si nywele atitamea. So hata ukikaa hapa for 10 years, it won't grow back. It's high time you start going out, you familiarize yourself with the environment and with people, and the earlier the better. Hizo zikani hit sana sana, and then I started going out pole pole mpaka nikadapt. Times kama hii za COVID, ku access services za hospital imekuwa very challenging. Saizi unajua hizi magonjwa kama za non-communicable diseases, hizo cancer ni kama zimesaulika. So ukienda tu hospitali haitachukuliwa serious kama ugonjwa COVID. So unaona tumetengwa somehow. So hata ku access hizo facilities imekuwa very hard. Ku access drugs imekuwa very hard. I think the areas that the government inafaa kuwa involved mostly, your COVID-19 committee wapate someone living with non-communicable disease, mwenye anaweza angalia masilahi ya watu wanaishi na hizo condition.
My life changed when I found out that I had sickle cell. I had no idea what it was. I had no symptoms for the past years I had lived. Emotionally, it has been a bit stressful. I was not used to living with it. My mom has really been there for me. She is the one who takes me to the hospital most of the times. My friends usually console me, telling me, it's okay, you'll be fine. When I deal with it and my family is there, I'm consoled and I feel much better whenever I'm with them.
I would like the government to see like this sickle cell with this disease. It's just like any other disease like AIDS. AIDS patients get medicines, but even this sickle cell people, they have just to see us through. It's so hard for us. The drugs are very expensive. Let us just have drugs, free drugs for these patients with these diseases.
I have a support group known as the Stroke and Hypertension Association, where I'm the chairperson. I have monthly meetings where we share group meetings, where we'll share the experiences. COVID-19, gosh, to say that it has been a challenge is an understatement. It has been terrible. I'm now limited in participating, like reaching out. When they're unwell, I'll go and visit them. Because of the COVID safety protocols, it has not been possible. So that has restricted me. And then secondly, the way they have been communicating to persons with the non-communicable disease is terrible. Because as they're doing their briefing, they're doing it for our good. But then they also, what they've not realized, they cause fear. You tell someone with diabetes, COVID is killing people, especially those with diabetes. God help me. It creates fear. So COVID has caused me to be so scared. I was very confident before, but now I'm less confident. I'm scared, I have anxiety. So the government can put health as a priority. Because when you have a healthy nation, then economically, this will become very economical and the GDP grows.
My employer is a good one, and we have a good insurance cover. But initially, therapy was not covered. Insurance has congenital disorders. My first time to hear it was with our first insurance at work, when now I presented the therapy to claim what we had paid, and they said, sorry, no, this is a congenital. What do you mean congenital disorder? Yeah, he was born with it. So we are not paying. Hey, so someone who was born with something they didn't choose, you won't pay. That blew me up, and we had a lot of up and down with my employer, and we had to change that insurance. And now we are covered. But I can assure you 80% are not covered. And some will say they will not disclose. So that discrimination, I will not say that my child has Down syndrome, so that he's covered. So IRA should reach out to all the insurances. We did that for HIV, and that has helped reduce the stigma on that. Why should they be discriminated? That is quite a huge thing for caregivers with children with Down syndrome.
Riu thina wake ringi ni kuriganirwo, ringi ni arwarire, ringi ni athire ni orire. Riu ni mathina riu ta irio, riu nona ringi uguthie wira, ona wathi kuhoya wira wa nguo kuheo nu na andu me micii. Ibatie kumateithia mamenye kiria maririaga, marugamirire oko ni maundu ma thibitari, mabatie kumenya maundu ta mau riu. Akorwo ni kuria mamenye kiria mweri ucio maririaga.
Me, I lost all my friends. I don't have them anymore. I stay alone, like you can see. My family have been very supportive, actually, and they have been doing everything for me. When the pandemic came, it changed a lot of things. Those who used to help me there before, they were sent out of their working places, and so the support ended there. About government, I've received none ever since I started. I've looked everywhere, MPs, MCAs, no help. I walk all the way, I think it is over 3 kilometers, hadi kwa barabara uko main. Sasa hiyo ni asubuhi, I usually go dialysis at 4. I've been in dialysis for 6 years. NHIF fund me. They pay 9,500 each time I go. I go twice a week. Now if you calculate that money for 6 years, hiyo NHIF wangeiweka ikuwa inasaidia patients mpaka wanafanya transplant, full transplant, not halfway. Wangekuwa wamesaidia watu wengi sana.